Well, you've been in practice for over 30 years. You are a product innovator. You have some really out of the box products that give frustrated pet parents a really awesome option. And we want to thank PAX for inspiring all of these beautiful products. So if he can join us on the Zoom, we're more than happy to host him also.
Well, it would be lovely. Like I just went for a cuddle. We were, my one of my team members and I were reviewing videos that we'll be launching this week on hormone health that I recorded with Dr. Karen Becker, and it's 5-part series. So we're going through it, and we have a lot of fun. But Pax was he skipped the meeting, and instead he's sleeping because he's terribly jet lagged. We just came from Prague. 2 days ago, and so he by 5 o'clock, 5 p.m. he's got midnight and he's sleeping. So
Oh,
I
how old
could
is
invite
he?
him, but he's six. He's six, and he's trouble most of the time. And actually, he's very sweet. For those of you who know him, he's yeah, he taught me so much. It's absolutely dizzying. It's he made me not wanting to retire for the next 20 years because of what he taught me. So.
Well, and I did think that you were retired because you have a seizure disorder, right?
Well,
Or
no, I don't have actually. That's so interesting how, I'm learning about how news travel and how it's like, do you remember when we had recording tape recorders and we would kind of like copy tapes? Like every time you copy that tape,
the,
it
the
actually changes
telephone thing.
and it gets more fuzzy and fuzzy. So I'm actually a sleepwalker and I
Mm.
sleepwalked through glass door and I almost died. I cut an artery in my leg by basically falling through glass door. And and he is trained to actually prevent me from sleepwalking. So he's very lucky. And I'm very lucky because of my condition, he can fly in the cabin and we go back and forth between Europe and Vancouver. So yeah.
That's
So
incredible.
seizures, I don't, I'm not planning to have seizures.
Yeah, good. Well, I was like, you're still in practice. How are you doing this?
Well, I am
And you
actually,
travel so much.
well, so I retired without really wanting to retire, but after 30 years in practice, and this is such an interesting situation, and I don't mind sharing it. In 2018, I had a friend and a client who was adopting a puppy, and the puppy was 2 months old, and it was adopted from a local SPCA, the Society for Protection of Animals, and they wanted to neuter this puppy at 2 months. And this puppy actually had neurological tremors. So I called them and I said, listen, like this puppy is not okay. I'd like to postpone the surgery. And at that time, they actually threatened this our client that they would repossess the dog if she doesn't neuter it. And
Wow.
so that started a very interesting kind of row with the College of Veterinarians in British Columbia here. And they came up with the idea that I actually could either keep my, politics. So they came up with the idea that I could either keep my license or I had to give up my products because I was endorsing products. And endorsement is third-party product, but they still kind of insisted on it. And so I decided to give up my license, and I'm now currently licensed in the European Union. So I'm not licensed in Canada, and I basically stopped practicing. But that gave me space to actually, how things happen, right? After 30 years, that gave me a space to really dive fully into product formulation and also sharing information online for dog lovers because I do have a feeling that applies to not only to veterinary medicine, but also human medicine. The times when we could rely on doctors for complete support, complete care are gone. And I'm definitely experiencing it in the human medicine, but in veterinary medicine, I'm seeing it as from the situations that I deal with sometimes with my friends who come for an advice and so on. And I see what's happening, how expensive it's getting. And so being able to actually give free advice to anyone who needs it in the form of videos and articles and courses and sometimes direct communication between my team and I and the client. It's really fun actually. It's really interesting and I love it and it just kind of makes me feel useful. So that's nice.
Oh, I had such, I had a different idea of you when I met you at Dr. Judy's, and I was just blown away by your humbleness. I
Oh,
really
thank
thought,
you.
I had you on a huge, huge pedestal and was terrified to approach you, actually. And you ended up being just the nicest, down to earth person. I was just like, oh my gosh, how could it get any better?
Well, thank you. I'm just a human, and you could talk to my partner or someone, and they would probably tell you that, it's not all golden. But I actually, I think that when life is a little harder early on, then you have a lot of opportunities to actually become, I guess, a little bit more aware of others and how to be. I grew up in the Eastern Bloc, behind the Iron Curtain, and it was not easy for many reasons, and also Eastern European upbringing and parenting. It was really interesting, and then I came to Canada, and I had to do my licensing and all that stuff, and so it was pretty harsh for a long time, and somehow, yeah, I've had also a lot of good people in my life who taught me the right values. So I don't think I shouldn't take credit for that. Like my good guides and my dogs and my clients, actually, dog lovers and cat lovers and pet lovers in general. You see so many life stories in the process of treating animals and being with them, and it just kind of like it's like a um, fast course on life in a way. Like you start seeing what decisions people make and what the results are and the outcome. And I think that in life, the most important part is not to make stupid decisions too often, right? Like we all make them,
Yeah.
but not to make them too often. I think that that's actually one of the thing that I try to do, try not to make too many stupid decisions too often. So,
It's the human condition, right? It's how we experience life between good choices and bad choices. But the animals, thank God we have animals because they love us through it.
and each of them has a different mission, and I have come to it's almost like come to terms with the fact, or it's not a fact, but the very high possibility that they really are channels for us. They really channel the energy, the universal wisdom, and they come to us, and they have a mission. Like my very first pet, my own pet, was a feline, and her name was Mina, which is a Czech name. And at the age of 7, she was fed kibble, obviously, and all that in the 90s. And at the age of 7, she ended up with hyperthyroidism. And I was studying homeopathy with Dr. Pitcairn, and I decided to treat her homeopathically, and she never needed medication until she was 21, and she was normal thyroid. So
Okay,
then I
stop the
did
bus.
about
Stop the bus on that. That's amazing.
It's amazing, but it's also humbling because so I to put together a study of 15 patients. Half of them recovered, half of them didn't. I saw where they would actually recover and what was too high. And then some of my and I presented it at the World Small Animal Veterinary Conference, and I was excited about it. And then some of my colleagues tried to replicate this, and it didn't work for them.
Oh wow.
And so
And
that
I
was a
read that
shocker.
study. I read your paper.
Yeah. So I think that when it comes to healing, I came to accept that there's so much that we don't know. And I truly believe that our belief and passion and openness to something actually is part of the cure. So that was, obviously, like I don't practice homeopathy as much anymore, mainly because I think that it's kind of ahead of its time, but it's also quite imperfect on the level of how we put it together. And it's very complicated. It's trial and error. And sometimes you actually, the more you learn, the more success you have. And I've seen some miraculous recoveries. But I find that some practitioners are so self-assured and so cocky about saying, "Oh, this is going to work and this is how it is." Like we don't really know how things are at all.
Especially
If
with
nobody,
homeopathy. Yeah.
yeah,
So what I've noticed in my practice is I started off on horses and I've tried a bunch of different modalities. And I found early on that things were my modality and things weren't my modality. And things were
yes.
different modalities were for different horses. So you had to kind of create a toolkit for things that you resonated with. And you
Yes.
hope that you have the right resonance for the animal in front of you.
And that's, I don't think that we really are, it's just like we're just seeing the tip of the iceberg, really, of what is
Like,
possible. And so, yeah, I think that the animals just kind of guide us. And Sky, my second dog, started having chronic diarrhea when he was like 5 months, maybe 4 or 5 months. I discovered the connection between spinal injuries and mobility and diarrhea and digestive tract issues. So that was really interesting. But I so wish that he and so many other patients were present now, because many of the chronic conditions that I've seen, or even the kind of like, the decline that we see it's always too fast, but it's faster than we would like. And I think that it's faster, it has to be. The decline can be slowed down, and many of the chronic conditions can be actually cured by very simply correcting metabolic health of the animals, including hormonal balance.
I
And
agree.
and that's what Pax actually came with, because he was 2 when he got neutered, and within 3 4 months he started limping, and I could not heal him. Like I was trying everything, all the different modalities, and nothing worked. And so we stopped swimming and we stopped hiking. And eventually I called my colleague that I used to work with in the veterinary practice for 5 years, and he became a board certified specialist. And I called him, and for some reason his office said, he doesn't have time for 3 months. So I go like, oh, bummer. Like, ah. So I started looking online and came across a study by Dr. Michelle Kutzler, who is a reproduction specialist, board certified reproduction specialist. And she published a study about 7 8 years ago about the fact that when animals are neutered, two things happen. They lose the metabolic function, um, and their metabolism changes dramatically, from tendon repair, ligament repairs, muscle healing, organ function, thyroid function, cancer rates increase, and so on. And so she actually linked it with neutering. And one of the culprits is also luteinizing hormone, which is from the pituitary gland, which stimulates normally the gonads. But when the gonads are removed, then the luteinizing hormone elevates 15, 30 times, and starts latching onto tissue elsewhere in the body and causes inflammation, propensity to cancer, behavior changes because it affects the brain, and so on and so on. So this was actually a real aha moment. And then I took about 3 4 months to um, make a decision to put Pax on the hormone protocol that Dr. Kutzler and Dr. Linda Brent from Parsemus Foundation suggested. And I was really worried. And I remember Linda was saying, Peter, like, just do it. It's going to be absolutely fine. So I did. And it's been year and a half now, year and a half, and he's been absolutely lameness free. Like if I almost feel like I should show you some of the pictures before and after, because it's absolutely mind blowing. And he's happy. And I have my dog back. So we put, Dr. Becker actually put her 17-year-old dog, Homer, on hormone replacement therapy, because he was obviously old, but he was also dog aggressive from previous traumas and so on. So he's now not dog aggressive, and they can go for
Oh,
walks.
you're kidding me.
Yeah, and aggression is actually one of the fearfulness, and aggression is one of the symptoms of what we now call the spay and neuter syndrome. I have my one of my team members' dog had a cruciate ligament tear. Unfortunately, it happened before we were able to put him on HRT, but he had repair of one ligament, didn't tear the other one, and is amazing. And I can again show you the pictures. And there's another dog, which is, it's actually a really sweet story. So he's a pit bull rescue from Maui. My friend, who's a single mother, has him. And about 5 years ago, he was diagnosed with mast cell tumor, which we know is, a serious problem. So because she didn't have money for surgery, I thought, why don't we just put him on rapamycin, which is an immune modulant. And it was like the first dog that I've ever put on that. Like it's an adaptogen or immune system modulant, and it actually increases the likelihood of the white blood cells to absorb and disintegrate the tumor it creates or causes what we call apoptosis, basically, disintegration of the tumor. So 5 years later, he's still alive. We actually can't find the tumors, even though they still may be there, but we can't see them. And so about a year ago, I thought, he's getting kind of depressed and lazy. Why don't we just put him on HRT? I have a video from my friend. This dog, this little pup, is playing on the beach with her little 2-year-old, like a little puppy. And I go, oh my goodness, this is so, so amazing. So there's obviously a whole background of how hormone works and what to do and what we don't know, which there's a lot of things that we don't know, especially when it comes to female dog hormone replacement therapy and how to actually adjust the protocols and so on. But the results are so promising that Dr. Karen and I decided to basically record this 5-hour series
That's
and
awesome.
hoping to actually not only create that movement, promote hormone sparing sterilization, which is a way of preserving the gonads and still protecting or preventing unwanted pregnancies, and hopefully eventually collect funds to do more research and actually kind of clarify what needs to be done with each dog and how to individualize the care. So it's like yeah, I'm so stoked and excited about it, and very grateful to PAX and my colleagues who have done this research. And yeah, it's like, wow.
It's very exciting. So
Yeah.
when you say hormone replacement therapy, I think of like women and estrogen, like wild jam and stuff like that. What are you actually talking about?
Maybe I should actually open that presentation if you don't
You
mind.
can. Yeah, I
Because
made you a co-host so you can definitely share.
I got the, I got
Yeah,
the,
because I came while you open, I'll talk because I came from the horse space. Stallions are stronger, healthier.
yes, yeah,
Mares, we never rarely spayed our mares,
yes,
and we
of
noticed
course.
that when you geld a stallion, they grow taller, but they're smaller boned. So
Yeah.
their hardiness goes away. They become more refined. And so we've always known that in the horse space. And so it came as no surprise that all these metabolic disorders with castration would be happening because we were seeing it already in the horses.
Yeah, my apology. I just had a flight and most likely got a little bit of a cold.
Yeah, you
Anyway, I will actually show you a few slides. So, there's like on, there are two different sites that you can go to and get the information. One of them is called hormonehealthfordogs.org, and that has the 5-part series with Dr. Karen Becker and myself.
right.
And it's like, if you have time to listen in the car or something like that, that would be perfect. And then I've had one kind of page, hormonehealthfordogs.com, that is on my website, and it has studies, about 50 different studies that we compiled together. It has interviews with Dr. Kutzler and Dr. Brandt and Dr. Becker, Dr. Ruth Roberts, who is also very keen and kind of in this kind of area. And it's really it's a good resource, but obviously everything is starting now. So I'm just going to share screen just to kind of give you a few ideas. This is, for example, this is actually shocking. This is an example of increase of different in percentage of different conditions post-neutering and spaying. So the most mind-blowing is that neutered dogs actually have 800% increase in prostate cancer, which I didn't know because I was taught that testosterone increases the likelihood, obviously it can cause benign hyperplasia, prostate hyperplasia. But the fact that there's 8 times as likely prostate cancer case if a dog is neutered is absolutely mind-blowing. And my general sense is that prostate cancer doesn't happen to young men and young dogs. It happens to older dogs and older men. So I don't think that there is any research that confirms it, but based on what we know, the luteinizing hormone elevates when the gonads are failing to produce enough hormones, even if they're not castrated. So there's a possibility that there's some sort of connection between the luteinizing hormone and the low testosterone. And obviously, when there's no testosterone, the prostate gland somehow has a higher propensity to cancer. And again, the only thing that elevates is actually luteinizing hormone. So it would be a really good study, not only for dogs, but also for humans to figure out whether actually hormone replacement therapy could possibly prevent prostate cancer, as opposed to thinking that testosterone actually causes it. It doesn't look it, right? So obviously cancer increase or elevation is about 400%. Bone sarcomas, cognitive disorders, about 3 times the increase. Growth plate abnormalities, joint disorders, about 50% increase. Hypothyroidism, again, somewhere around 40%. Behavior changes about 30% higher. Urinary incontinence, obviously, we all know that, and obesity. And what I actually noticed with packs and with other dogs that when they are put on hormone replacement therapy, that they slim down. And when we look at us humans, as we age, it's harder to keep our weight down, right? Because, it seems like we eat nothing and we keep gaining weight. So that may be, again, just the metabolic effect. I'm going to show you the differences of the dogs that I talked about. So this is actually, this is Bo, my team member's dog. Before obviously cruciate ligament tear, um, a dog that did not have quality of life. He had a surgery, so post-surgery he's doing super well. But you can also see that his back is nicely aligned. What I noticed with the dogs that even with packs, when they go on HRT, they stop being sore. So if a dog has back pain, neck pain, sprains and so on, it seems to correct. Now, this is before HRT on the right upper side, and this is after. You can see the expression, and it'll repeat because this is my dog Pax. Uh, this is before neutering, after neutering, and after HRT.
Wow.
Obviously, the pictures are not exact, but the middle dog looks like a different dog.
It does. And we do iridology in this group, Dr. Dobias. So we
Yes,
do
wonderful,
companion animal
wonderful.
iridology, and his eyes are so dark in the middle.
Yeah, of course. And it may be different exposure, but still, you see no spark. I
Right.
know.
The white
Yeah,
is not white. The coat's dull. Like everything's dull looking.
yeah, yeah, exactly. And so this is the fun picture. So this is the little boy with his little brother, and um, and this is about 6 months after HRT started.
Oh, he's spicy.
So my philosophy now is if I am to decide as a practitioner or as a dog lover or guardian whether my dog is gonna, even if there was a shorter lifespan, I go for better quality, and there's no sign that the shorter lifespan will happen, right? Some people actually, some naysayers would say, like when we put them on HRT, it's like they burn their candle on both ends. But then you look at look at this, and I go like, look, listen, like there's so many signs of poor metabolic health. Like, how can that be actually conducive to better, longer life, right? Like it just like I think that it's really worth exploring because the initial evidence is really pointing to better quality of life and much better results. And this is actually Dr. Becker's dog again. And from the point of iridology, Homer, he can see left and right? Like a different dog.
He
And
looks old in that first one.
yeah, and you can see also, and that's the side effect, that it makes us so unbelievably happy to see our dogs being back. And, like experiencing it, like there's two options. You either go, okay, I figured it out for my dog and it's great and I'm happy. But then, like, how can you actually go to dog park and see all the suffering and hobbling around and all that without actually doing something, right? So, you guys, if you are able to subscribe to Hormone Health for Dogs.org, please do, because we'll be really putting a lot of effort, and there's nothing for sale on the website or anything. It's just that we really love doing this, and we hope that we'll be able to make a difference. Um, I'm not sure if there is anything else that I could show you here. I'm
Well,
actually,
that study is shocking. And that study is going to force us to look at prostates differently.
yeah. So this is actually, it's not one singular study. What I did, I took the 50 studies and I analyzed it, and I asked basically what the conclusions are. So as I compiled them all together into one little graph or one little chart, basically. There's an
Oh,
interesting there's an interesting chart here that kind of tells you how many metabolic functions, for example, testosterone has, right? From reproduction to muscle health to mood to digestive tract. The other thing is that Pax was sensitive to chicken, and he's not anymore.
oh,
So yeah, I know. And this is the mind-blowing part, that it does seem to actually improve, obviously, the metabolism of the body, and suddenly sensitivities and allergies are gone. Um, I'm not saying that it happens to every dog, but it's very possible. So in female dogs, it's a little more complicated. Where is my, I wasn't prepared to present this, but obviously I want to now because I realized there's an opportunity to share this information. Um, in female dogs, we still are not 100% sure how to actually do hormone replacement therapy for all females because, well, we decided now that the protocols that we are using and we'll be using are combination of hormones based on the clinical symptoms. So if we have, let's say, urinary incontinence or some sort of sign of estrogen deficiency, then we actually do estriol, ideally, because that's the lowest side effect causing estrogen. And the studies that say that estrogen actually causes cancer have been debunked in human medicine, and I have a feeling that they probably will. It will be very similar to canine medicine. Um, and the other thing is that the numbers of increase of potential cancer are relative. So if you have, let's say, cancer rate of 0.01 and there's 50% increase, it's still 0.015. So, if you look at all the other possibility of cancer and the increase of cancer in the studies, when dogs are spayed and neutered, um, I think that we should need to worry more about lymphoma and osteosarcoma and hemangiosarcoma and mast cell tumors and all those tumors that are rampant now. So again, more research is needed, but I would highly suggest, if you have a spayed and neutered dog and they have some sort of abnormality, chronic condition, mobility issues, to actually consider them on hormone replacement therapy. So in the females, it's combination of estrogen. We have not been really suggesting progesterone, and based on Dr. Katzler's kind of opinion, um, she believes that progesterone may be actually the one that may cause some additional problems and maybe mammary gland tumors, or even if your dog is spayed and you give progesterone, it can actually cause the uterine stump to inflame, and it's called uterine stump biometro inflammation infection that can be caused by the progesterone. In intact females, progesterone is actually produced mainly in the 2 months post estrus, post ovulation. And if we don't give progesterone, it's very unlikely that we would have this stump pyometra happening, even
Wow.
if the stump was there.
Could I ask a
Um,
question real quick?
yes, absolutely.
Hi, I'm Jessica Lynn.
Hello.
Have you also looked at how, Roundup and all the chemicals out there are also affecting the dogs with the hormones and their metabolic? I mean,
Absolutely.
okay, yeah, I have a new puppy coming, so I was really interested in this. I don't neuter my male dogs because I live out on a ranch and I have border Aussies. They do fine, and I don't see all the cancers and all that thing in my dogs. But again, my dogs are fed differently than most. It's all about their gut health, but also getting and keeping the balance in the body. I was raised on osteopathy, so I've transferred that to my animals as well. And I met Poppy because of one of my horses. And that was a long time ago, huh, Poppy?
That was.
20 years ago.
Yeah, it was like 20 years ago.
Yeah,
Crazy.
actually. But I
That's
think, too, that a lot of people feed a lot of junk crap food to their dogs, and all these cancers are popping up.
absolutely. It's not to discount all the other, excuse me,
Yeah,
No.
all the other elements,
right.
food, dietary deficiencies, spinal misalignments, toxins in the environment, toxins in the food. Those are the epigenetic factors, meaning that they're not in the actual DNA, they're the effects of the environment.
Right.
And most of the resources or sources say that 20% genes and 80% epigenetics, which I truly believe as well. So you're absolutely right, Jessica, that it all plays a huge role. Plus, you know, exercise, social engagement, um,
Hmm.
our well-being. Um, Dogs on the farm are lucky, 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 super lucky
Oh, yeah.
dogs. And I think that it's actually a very sensible thing not to neuter your dogs, especially if you have control over their whereabouts. Females, there is actually, when it comes to intact females, there is a risk of pyometra, about 25% risk. So
Mhm.
the current recommendation is at certain point, remove the uterus and leaving the ovaries.
Yeah, I was
Uh,
wondering about that. I wanted to
yeah,
ask. I mean, a couple of my friends were homeopathic veterinarians, Dr. Fenton, Dr. Glenn Dupree. I've got to talk to Dr. Fenton about the puppy. I was going to see if we could just remove the uterus when she got to that age. My one border Aussie, I had her spayed, I think, at 10 months, um, because he said, you let her go through a heat cycle so she gets the hormones, and then we'll get her spayed. But this is a small dog. This is a Maltese, and she's only 10 days old right now. So I've
yeah.
got time.
So I would not be removing the ovaries because,
Yeah,
Pax had hormones until he was 2. You see the result on the picture.
yeah.
He's developed strong. He had strong bones, but guess what? He lost muscle mass and he could not pull his body with the reduced muscle mass.
Hmm.
Um, with females, we recommend the ovary-sparing spay because of the pyometra risk, but it would be really worthwhile to do study whether the elevation of the luteinizing hormone in females that go through menopause later on in female dogs, whether that actually may cause propensity to pyometra. And I don't really know the answer, but it
Yeah,
would be really an amazing, amazing study to actually see, have two groups, right? One ovary sparing spayed and the other one on hormone replacement therapy with uterus and ovaries, and the third one spayed, right? And just follow them through a lifetime, which would obviously take 10, 15 years plus.
yeah.
And it would be so interesting. So, you know, we are ahead of a really interesting time, especially because rescue organizations and the humane societies and all those people don't understand that we don't promote uncontrolled breeding, but we cannot address one problem and cause another. It's just not basically, it's just a no-go for me.
Now, it drives me insane that the humane societies and the rescues want to spay and neuter kittens who are 6 and 7 weeks old. You
Yeah,
know,
Well, and I have a rescue dog, Foster, right now, and I believe he was um, castrated at 6 months, and he has an intermittent lameness. So I'm really interested in implementing this. What about the hormone, uh, the homeopathic hormone therapy, Dr. Dobias, like the
yeah.
luteinizing hormone and testosterone in a homeopathic or no-sode type form?
I mean, I've used the
Oh,
ones for the thyroid successfully with some of my practice.
what was that?
In my practice, I use some of the homeopathics for like low thyroid to get it boosted without having to do the drugs.
Yeah. You know, I have a slightly different hormone and sorry, opinion about hormones. While I am, almost never use many conventional drugs, never anti-inflammatories, never prednisone,
Yep.
unless it's Addison's disease, which is needed, right? But when it comes to hormones, I actually would put it in a slightly different category. And while I am very hopeful for homeopathy in many different ways, um, I just feel that it would be a really interesting trial. But if you ask me, would I put my dog through homeopathic trial or the hormone replacement therapy that I put him on? Knowing what I know now, I'd have a hard time actually not to do the hormones because it's almost like if you have a car and you have no fuel in the car or the spark plugs are not firing, you just have to pull the fuel in. And the biochemistry of the body, when you kind of go online and look at, the metabolic processes that these hormones power, I would say that it'd be fantastic if homeopathy works. But if any of you, if Poppy, you have a different experience with them, please let me know because I have not been lucky enough, and I don't want to discount the possibility that it may work. But
So Donna Middleton sat next to me while we watched your presentation at Dr. Judy's, and she went home and started a homeopathic luteinizing hormone inspired by you. And she said the results were night and day.
wow,
Yeah, and
that
so
is
I was like, oh my gosh, that's amazing. I'm so excited to hear that. So that's why I wanted to know your thoughts on it. But how do we even buy the hormone replacement therapy? Because I really want to try it on this dog. I don't know. He's got a lot of energy, Dr. Tobias. So I don't know if I need more energy, but I
well,
definitely
you're not gonna
hate
get more
seeing.
energy. You're gonna get calmer energy, possibly.
Oh, good. Thank you.
So, regarding the luteinizing hormone and what I know about homeopathy, I think that if there is, let's say, excess of luteinizing hormone and there is luteinizing hormone disease, um, it's very possible that using homeopathic remedies, LH potentiated remedy, actually would make a lot of sense. That would definitely make sense. The And it would be so interesting to do actually more trials. When it comes to the hormone replacement with, let's say, testosterone, based on what I know, like treats like. And so if there was, let's say, a disease caused by arsenic or disease like arsenic, we would actually use arsenicum album and it would help, right? Because we actually treating the effect of that noxious agent. But the absence of a hormone is something a little different because it's not a hormone disease. It's a disease caused by lack of the hormone. So I just like, I'm not necessarily even saying that I'm correct in my assumption, but when I'm making decisions in medicine, I try to put some sort of logic into it. And if I'm wrong, I'm very happily to acknowledge me being wrong. It's not a problem. But that's just how I see it. You ask how I see it, and this is how I see it. So the LH homeopathic remedy, I think it's fantastic. Hyperthyroidism using natrium muriaticum, which is basically table salt that causes very much the same symptoms as hyperthyroidism. Obviously, it worked. And yeah, we just have to be open-minded. That's all.
Yeah, and I think it's a collective community where everybody, like you and Dr. Becker, are talking to all these other people and people can compare and contrast. And toss out theories and welcome new theories. But is there a specific place I can purchase this?
So I'll show you actually the plan, and then I'll talk about that as well. So the hormone replacement therapy, you can take a screenshot. This is what we currently use, and there will be many different opinions about what plan to use, and whether to give testosterone once a month or once a week. We've concluded based on the results that it's actually better to give it less frequently, so you don't take your dogs through a roller coaster of up and high and low, right? Because a month is a long time, and it drops and it goes up and it drops. So we give 0.5 milligram per kilogram under the skin, insulin needle, very simple. Your dog will get a treat before, treat after, they don't even know it. And Suprelorin is actually another part of the protocol that we use. And it's a medication, an implant that reduces, basically stops luteinizing hormone production. And originally, this medication was made for preventing fertility temporarily. So you give this implant, luteinizing hormone stops, your dog doesn't produce sperm. And then after it expires, they start producing sperm again and testosterone. So that's the male protocol. When it comes to females,
Get over here. Shut your mouth.
uh,
Get over here. Get over.
when it comes to females, I can get over there, but I'll do my best.
Janice, I muted you,
No,
Janice.
no,
We
no,
could
no,
hear
it's
you
okay. It's
scolding your
okay.
cat.
Oh my
I
God, he
thought it
will
was,
not be quiet. I'm trying to listen to this and it's
I
he's
thought it was funny. No, I just thought I would crack a joke. Um, um, so we can measure estradiol and see if it's sufficient. Dr. Katzler thinks that the estradiol levels that are produced by the adrenal glands are not sufficient. But still, like if your dog doesn't have any symptoms of estrogen deficiency and is healthy and fine, females do go through hormonal fluctuation even when they are intact. So they are not as prone to the spay and neuter syndrome, I would say, a little less, but still it can be, right? Um, then luteinizing hormone cannot be measured, so in North America, so it's out of question. So we would still administer Suprelorin implant if we see the symptoms. And currently, we say if there are no symptoms, no Suprelorin, right? But it can be, and again, like if we are able to measure luteinizing hormone, we see that it's elevated, then it may be actually a good idea to use Suprelorin. And the other question is, if the ovaries, the gonads are missing, and there is a normal level of luteinizing hormone, is it still going to be latching onto the other tissues and causing inflammation, maybe cancer, maybe hypothyroidism and all that? Again, it needs to be researched more. Oral estrogen doses are right here. And we have, I'm so sorry. Next time when I talk to you guys, I won't be flying 2 days before.
Oh,
Anyway,
we're sorry. We feel really
no,
bad for you.
don't feel bad for me at all. I'm not
Thank
suffering at all. I'm enjoying this get together. I feel like you're suffering listening to me hacking.
Not at all.
Anyway, so in females do produce about 10% of testosterone, and it is important for mood, for cognition, for libido, for muscle strength. We have kind of decided that if we start seeing musculoskeletal issues or back pain or anything like that, that 0.25 milligrams per kilogram under the skin weekly actually is a good indication. Dr. Ruth Roberts actually has a female dog, and because she's mainly has muscle weakness, sarcopenia, we call it. She's got some other mobility issues. So she has her only on testosterone and not on estrogen. But again, you really have to work with a practitioner that is open-minded and just kind of adjust the plan, the protocol based on what you're seeing. Now we're getting to where do you get all this? some countries do have Suprelorin, which is the implant. And in the United States, it's permitted or it's approved for ferrets, not for dogs. But you can actually sign a waiver with an open-minded veterinarian, and they can implant the Suprelorin for ferrets because it's exactly the same medication. Parsem is
Can't, that just drives me crazy that you could do it for your ferret, which is kind of illegal to have in California, but you can't do your dog. That's hilarious. And I just
not
never thought about
much makes
castrating
sense
my
in
ferret.
medicine. Not much makes sense in medicine.
I have to agree with
Uh,
you. I'm so tired of the white coat syndrome and everything else that goes on.
It's, I still do believe that most of my colleagues really are caring and kind. We have gone through vet school though, and unless you're a little bit of a rebel, you're taught this is how it is, this is what you do, how you pass your exams, and you can't do any other way. So we become a little fearful, a little inflexible, and then you have to really lose the fear of losing your license and someone suing you, kind of hoping that because you have good intentions that your clients and customers will actually know that you care. And you just kind of lose the fear of losing your license to someone suing you, right? But it's
That,
okay. It's a
you
very
mean that somebody would respect innovation?
Yeah.
Is that what you're asking for? Why would you even think? I have a
Well,
question about the hormones. Now, I don't know if you're familiar with Ton Jansen, who is a homeopath in the Netherlands, and he has a practice based on human chemistry. And one of the things he does is he uses a lot of sarcodes
yes,
for balancing. So
yes.
he'll use thyroid for balancing. So I wonder if we could use the luteinizing hormone for balancing. And he uses testosterone and progesterone for balancing. I'm wondering if we could do it that way.
I'm not familiar with the use of sarcoids. Is it glandular supplements or is it something
They're
different?
they're they're it's tautopathy. They're remedies made from the tissue.
Yeah, so it's basically a remedy made from glandular supplement, correct?
Yes.
Uh,
And potentized to a homeopathic level.
it is so. The luteinizing hormone, as we discuss here with Papi, maybe maybe actually good indication. And when it comes to others, like I don't really know, but I don't think that it would be contraindicated and it would be nice to try. And I would not be surprised if it worked.
Hmm.
But again, I don't have experience in that area. Um, yeah. So yeah, all I can say that the Suprelorin implant, especially in males, seems to really be necessary to actually reduce the LH and reduce the inflammatory process. Some people ask, so what if I give just testosterone? Will it reduce the LH? And they've tried it, and the doses of testosterone must be much higher in order for some of the dogs coming down with LH, which again may bring some undesirable side effects. Testosterone is metabolized by the liver, and we haven't seen any side effects in the patients that we've replaced. I mean, hormone replaced. But I don't like high doses of testosterone personally. So I prefer going this route because it does seem to work, and we've seen good results. And yeah, I think that it's my preferred protocol. Testosterone in the United States, again, not an easy preparation to get. We have not done or dermal application of gels or creams. Uh, it would be, from my opinion, relatively difficult. Like it's not as reliable for dosing. You'd have only a few areas on the dog to apply it, and usually there's hair, right? That's on the neck. You don't want your dog to lick it. Number one, it's not good for them. Number two, it doesn't absorb through the gastrointestinal tract, and it's not gonna be effective. So,
And
if you can
doctor,
go, uh,
um, I've had clients do testicles in their dog's food, and that
yes. Again, based on what we know, testosterone cannot be given orally. It doesn't basically,
Absorb.
it
Okay.
does absorb, while it does process to the point where it becomes ineffective, basically. But yeah, so it's just not right now, it's not the route that is available. I have a feeling that they may have been doing some trials, or maybe there's medication for humans that may be oral, but I would have to search more. Like I just barely heard of something, but I don't know much more information at this point.
Well, I'm excited to keep an eye on that. Debbie, did you want to ask a question?
Yes, thank you. I have a 6.5-year-old lab. She had to be, well, the general consensus was we spayed her March of last year because every time she had a heat cycle, her hormones were just, she was losing hair, she was just having horrible things going on. She's raw fed, she has supplements, she eats and better than we do. And she's getting a really white face already. She's a pet therapy dog, and she's getting really tired if she goes over half an hour, even less sometimes at the hospital. And she just is looking really old to me, and she's only 6.5.
Yeah.
And what tests, I may have missed something, I'm sorry, but what tests, are there blood tests to do to see if she needs HRT? I would be ready to put her on it tomorrow if that's what she needs. Poppy
Yeah,
knows.
Yeah, I agree.
so in this kind of situation, your vet may want to measure the estrogen, and the luteinizing hormone again is not available to test in North America, so it's out of question. But if you start seeing this in a 6-year-old dog, she needs to be put on HRT. And I think that in this case that you described, I would put her on both estrogen and testosterone. So again, like the question is like, in parsemus.org, you will find a list of veterinarians who are willing and open-minded to do testosterone replacement.
I have a home, losing my words. My vet that I use, she gets acupuncture and she's done chiropractic, and I'm pretty sure he would agree to doing that. He is a vet. He was also a vet for like 25 years before he started focusing on acupuncture. She hasn't had vaccines since she was 12 weeks old, and her levels are still good for her rabies and all that stuff. So I'm definitely going to listen to this again and get some direction from Poppy, I hope, and I just had an appointment with him last week, but I'm going to contact him and see about this.
Right. Dr. Dobias, the few female dogs that I've ever worked on with Addison's all got spayed within like the year. And they were all female. So I don't know if there's like, I'm worried for Debbie's dog now that I'm listening to you and putting like all the pieces together. What are your experiences on that?
Addison's, obviously for everyone who doesn't know what actually happens in Addison's, adrenal gland dysfunction, basically minerals and electrolytes go off balance as a result of the absence of the hormones, the mineral corticoids. And it also, the adrenals stop producing or minimally producing cortisol, which is an important stress hormone. So it's a deadly condition if it's not corrected, or, initially it is actually very common in poodles, and the hormones have to be replaced in order to save these dogs and treat them. If you're asking why this happens, we would have to do study to see the difference between the incidence between spayed dogs and unspayed dogs. Based on what we know, it's possible that the luteinizing hormone starts attaching at the adrenal gland level, and destroys them, right? Like if there's some sort of inflammatory immune reaction, but I don't really know for sure. Once again, this would be an amazing study if we had some sort of, fundraiser and say, okay, these are the studies that we were online. It would be an amazing study. And if there are people who actually would even like to actually register as volunteers, we will be actually taking on people who hopefully will help us with the mission and will help us with fundraising and research and all that. We have plans to do all that, but it'll take some time. Now, as I'm talking too much, I kind of forgot what the primary question was. Was
For
it?
Debbie's dog, well, the
Oh,
primary,
yes, we
the-
were talking about the lab, 6-year-old
Yeah.
lab. I would like to actually show you one picture that I got sent by a friend, and just a second, I'm just gonna find it
thank you
because
for doing
there
this.
was
And I see there's people chatting in the chat.
While you're looking for that, I'll comment that Taya still enjoys chasing after her frisbees and jumping up and catching them and all of that. But it's just her, she just gets really
Yeah.
tired and
yeah, you see the premature signs of aging, basically.
yeah.
We throw these dogs through menopause, basically. And if any of you know what it feels like, we throw them through menopause way too early. And you may be asking, so, isn't that natural to go through menopause and then in men for through andropause? Well, I have a theory about it. I actually think that nature basically never intended us to live this long. And we kind of surpassed the regular lifespan of a human being. From nature's economics perspective, even though it may sound harsh, grow up, procreate, raise offspring, maybe have grandparents help you out, raise offspring, and then get out of here because we need another generation. And so the decline of hormones and decline of NAD, which is another story, mitochondrial energy, and we can actually have another talk about that another time. But decline is kind of programmed in our body, and we kind of live much longer, which is obviously a problem, right? Because we are suffering from all these different diseases. And aging actually is partially related to, errors in transcription in DNA. And it's just basically you're copying the tape over and over and over until it's barely, sounding like the original. And then the hormonal health. So there's the DNA transcription issue, and there is also hormonal balance and metabolic health. And yeah, so it's interesting. I want to show you this. You see two dogs. One of them is older, one of them is younger. Which one do you think is younger and which one is older?
Sounds like a
Well,
trick question.
I know exactly. I was going to say the same
Oh my
thing.
goodness. Like I have to figure out how to ask a different question.
So the one on the left is younger?
The one on the left is younger, yes.
Wow.
And which
By
one
how
is spayed and which one is neutered and which one is not? They're both males.
Well,
wow.
the gray-faced one's neutered.
Yeah.
So 11 and 13. And the gray one is neutered. From the same family, the same food, the same supplements. So this little doggy will go on HRT. And
Okay, so may I go backwards a little bit? What exactly am I asking of my holistic vet to do first?
So I would just, you have two options. If they feel comfortable, uh, they can just connect with me if they have questions, or they can connect with Dr. Michelle Kutzler, but she currently is actually on sabbatical. We'd be very happy. I'd be very happy to connect with. I've talked to several veterinarians now, and just kind of give them the necessary support to dare to start and then start seeing the results. So they can.
I appreciate
Or
that very much.
You can also screenshot this
I did.
and screenshot this,
Hmm.
and if they have any questions. The other thing is, it would be really lovely if we have veterinarians coming to hormonehealthfordogs.org and hormonehealthfordogs.com, and looking at the information and listening to the series, and then connect with us, because I'm sure that Dr. Karen Becker and I both agree that we'd like to be there, and part of the success of this mission and the transformation is to talk to our colleagues and share what we've humbly learned, because 2 years ago I did not know a lot at all, and because I needed to solve a problem, and I was somehow lucky to kind of the universe plans it in an interesting way, because if my rehab colleague said, okay, I'll take your dog, I'll look at it, my dog would probably be going through platelet-rich plasma treatments and laser treatments and all that stuff. And we did use actual laser at home for PAX as well during the recovery period. But I haven't done laser for him for a month, and I do it kind of preventively, just for maintenance, because it does stimulate stem cells. But it's like he's fine. Like I went through like a year of anxiety about him running and hiking and swimming and so on, and now I go like, oh, it's fine. He's 6.5 now.
That's
He's
so
so much better
exciting.
than when he was 2.5. So please don't hesitate to connect with your veterinarian. Tell them that they can email me through the website and just say that, obviously they're professionals and that they would like to speak with me, and we'll make arrangements. No problem at all.
Thank you so much.
Yeah. Or Poppy can also communicate with Robin or with my assistant, and yeah.
Excellent. Well, I look forward to sharing this with all my vet friends.
Can I please ask a question?
Yeah.
Of course, he make my day, because I really enjoy this, and yeah, it's a lot of fun. Thank you.
Okay, so it's Candy. Remember her from Dr. Judy's? Do you see Candy from Dr.
Hold on.
Oh
Let
yes,
me.
yes. I wasn't sure whether you were saying Judy's or Julie's. Hi, Candy.
I'm
Hello,
Julie.
hello.
That's
Hi.
Candy. Her birthday's on. She's gonna be
Let
a
me-
year old on Wednesday, and
Uh-huh.
I'm going through this whole debate of OSS or spay. I have asked a million. Obviously, I have a lot of vets at my fingertips to talk to. I have talked to many vets. A lot of them are very pro OSS, but all the vets who've ever had hands on her, and it's more than I expected, don't want me to. They want me to spay her and do HRT. They gave me a whole laundry
My
list of
goodness.
why they don't want OSS, and there are always the same reasons. And I just keep going on this seesaw, back and forth, back and forth, back and forth. And I was just at Beth Hirsch, if you know who she is, on Friday with my other dog. She saw Candy. We had a long talk, and she said, no, I'd rather her spay and do HRT. So it's like, I'm so confused what to do. It's 1 second I'm OSS, next second I'm on spay. Any thoughts? And then
No, obviously they have some sort of foundation for their belief or recommendation. So I want to respect that. I don't understand it. I would have to ask questions. Um, it does not make sense.
My general feeling is they want to be able to control everything. And if they're leaving anything up to the body, it's not being controlled by them.
yeah, but they're not my vets that are telling me this. I mean, 2 of them are, but the rest aren't.
But that's sort of when I've talked to vets, that's sort of their general well, it's not just vets. I worked in healthcare for 40 years. It's kind of the way medicine wants to be able to control things, because they don't trust natural processes to work properly.
Yeah,
Yeah,
but
it's not
with
really
these
healthcare.
yeah, but
Huh?
these people
No, it's
do.
not healthcare. That's exactly right.
Yeah, but the people I've been talking to are very holistic, very pro natural treatments. They've just got negative against OSS because what happens if you have a stump uterus and you get the PIO? What happens if a male dog ties in with her, which would never happen with her because she's by my side all the time? What, if she has a problem when she gets into heat? What, they give me this whole laundry list, and it's always the same thing. And they all think for a small dog who's 8 pounds, and that I should just go spay. And
That's controlling though. That's what they're saying. I get completely what you're saying, Janice, because preventing all of those things through doing a procedure is controlling.
right,
Do you
and then
have to spay her anyway?
I do, yeah, well, I don't probably, the breeder would never know. And I'm concerned too, because I just got off a Shih Tzu with Cushing's, which and Gigi has a ton of problems, and I'm sure that she's partially because she was spayed and partially because she got 2 sets of vaccines before 2 years old, because she was dumped, with the shelter.
Yeah.
So I don't know. I don't know what's right for this little girl,
Well,
and I want to do right.
In situations like these, I do believe that they probably have some sort of concern about maybe uterine stump pyometra, but if you remove the uterine tissue and you do the procedure properly, then there is no uterine tissue and there is no stump pyometra, number one.
Right.
Number two, ask questions why. And if they don't really give you a clear reason, then you can't even deal with that. But most importantly, you're the guardian of your dog. You're making decisions. You know what you want to do. You're taking responsibility for your dog's health. And they either need to respect it or you need to find someone who does. It's almost like, how we sometimes have people in our lives, and with some we jive and it's like easy and there's alignment, and with others it's struggle. Over the years, I learned that it's actually better to let it go and just kind of create a group of people, including professionals, including veterinarians, who actually are aligned with you. And it's more difficult, and I completely understand it, that it's difficult to actually look for a veterinarian who wants to do or who's open to do ovary-sparing spay. But the other option is that you will leave your dog intact, but there's 25% chance that the pyometra will happen. But as I said, I would be super keen to do research to see if females with HRT actually don't get pyometra. The same way neutered dogs seem to be getting cancer more likely. So is it possible that the drop in hormones later on actually plays a role in pyometra and prostate cancer?
I mean, the good news is I'm not doing anything till at least 18 months, if not 2 years. So I still have time to keep weighing, and I'm still tending to OSS because in the long run, I think it's better. And I think Kendra Pope gave me a doctor in Jersey, and I found what I think is a really good clinic in Florida. So, I'll just go camp out at one of my 2 homes, decide where.
Your dogs are lucky.
The
Hey,
problem is
Poppy?
I know too much. That's, there's a good thing knowing a lot, but when you know too much, then it becomes even more of a problem.
Well, I think that in that case, it's almost like obviously you're very open-minded and you have a few channels open. They say that the brain is like a receiver, not the thinking machine that we thought, but it's like a receiver of the knowledge. And so in your case, the art is in knowing which channels to close and which ones to leave open. And it'll feel more organized and more sorted. But I think that you're there. Like, I wouldn't be afraid to be your dog.
Right. And Julie, I'm also thinking like you feed really healthy. The percentage of dogs that get pyo maybe are not on like raw fed or
Very
home
possible.
cooked. And like I don't think we have researched it enough to actually know the hazards of the healthy dog, female intact dog. So, and there's always ozone. So
I mean, everybody keeps telling me too, we've had so many dogs come back who had OSS and had to come back and get the ovaries removed. And then Beth was telling me, oh, you have no idea what it's like trying to find those ovaries once they're not attached to the uterus anymore. I mean, like they're all in these all crazy stories about, the ovary. I've had about 6 people tell me they had to go back and get the ovaries removed after the fact.
Really?
So, and
I would love to actually speak with them. Why?
Yeah,
I can hook you up. Seems to be the Jersey doctors. It happened with Jerry Bukoff and with Beth Hirsch.
interesting.
Is
Well,
it possible that they had not they had only partially removed uterus? Well, maybe that's possible. They had
Yeah.
some pyometra or bleeding or some sort, but
And one of them I know was behavioral, that the dog became very aggressive and very nasty whenever it got in heat. But there's just, and then similar with the cat as well. So I don't know. I mean, as soon as I get all set on OSS, it's like I start hearing the horror stories from these guys. I'm like, now what?
well,
So I
it's-
just
at
go
least
back and
you're doing your research,
go.
Julie. Yeah. So maybe in a year from now, we'll have a whole different option for you.
And Julie, you just have to go with what feels right. Like I sometimes, when I'm having a hard time to make decisions, I take two stickies and I write the two options on the stickies. You'll be attracted to one more than the other.
right, do muscle testing with them.
We can muscle test. You can just look at them, do whatever, but you know the answer. Actually, you know what? Go with the route of least regret. Go the route of least regret.
I love that.
Yep.
I
Almost
love that too
any-
because it
anything
takes
in-
all the
anything in
control.
life, anything in life, go the route of least regret.
Hmm.
When I was deciding to put Pax on HRT or not, it was easy. I would not know if there was a solution for him. And if I didn't dare, I also would not, if I didn't jump off the cliff, not knowing really what would happen with him, I would not be able to help him. I would not be able to help other dogs. I would not really, I probably would not love the work that I do as much as I do, because it's almost like it's not just about hormones, it's about all these different pieces. Like Poppy teaches you different techniques and approaches. Like it's about blending it together. And when the pieces of the puzzle come together, like you can make a puzzle from one piece, right? Like you make a puzzle from many pieces. And if they fit well together, that's beautiful and amazing. And then we have we have good results. I have to confess, and this is I'm gonna go off the track a little bit. I I was buying Lego for a son of our friend, and they had a big Lego of Concorde and love planes. So I bought this Concorde Lego and I have to put it together. So I'll tell you how the pieces of the puzzle are. And maybe medicine is like the 3,000 piece puzzle, right? But some of them are more
3,000.
complex.
3,000 pieces. Oh my gosh. That's ambitious. You're going to put it together.
Maybe when I retire, which I don't plan to retire, but every day like 5 pieces. It's also about learning. Every day 5 pieces to learn, right?
So I always tell everybody I feel the body is a Rubik cube, and that when one cube is off, the whole thing's off, and each side represents parts of the body. And so it just throws it into imbalance.
That's a really nice analogy. That's a really nice analogy.
Yeah,
Put
thank
it
you.
together, it feels great.
So Christina's been waiting to ask you a question.
Oh, thank you, Poppy. Thank you for being here,
Hi,
Dr. Dobias.
Christina.
Hello. Okay, so I am just, taking copious notes here. I just want to make sure that I understand that there is no real test in the North America for luteinizing hormones. So how do we? I've been doing the homeopathic luteinizing with. I've got a girl that's going on 5. She had babies at a young age and they were taken from her, and then they spayed her in the shelter. I guess she came in without her babies. Anyway, I don't really know her full background, but now she's going on 5, and she's got a lot of reactivity toward other dogs. And I've been listening to Rita Hogan's class on early spay and neuter and the after effects, and I'm pretty certain that has a direct impact her reactivity, because she was spayed too early. So the question I want to ask you, you said something about I was looking at this photo that I took of the screenshot you said to do the Suprelorin implant in the presence of LH disease symptom. No symptoms, no Suprelorin. I don't know how I missed this, because I've been like totally dialed into this presentation, but what are the symptoms?
Symptoms can be pretty much, this will sound really almost like too simplistic, but symptoms can be any chronic disease that doesn't respond to treatment, or any behavioral or emotional changes that happen after spaying and neutering. Behavior changes are known to be part of the problem based on the studies. The amygdala and hippocampus, which are the emotional centers of the brain, are very prone to inflammatory changes after the luteinizing hormone elevates. And the complexes were found by Dr. Katzler in those areas of the brain.
Mhm.
We definitely see more reactivity in dogs that are spayed and neutered. We usually say, that the neutered dogs actually don't like the unneutered dogs, right? Well, they're just reactive. They're just reactive.
Yeah.
Homer, Dr. Becker's dog, obviously a good example. She couldn't even walk him on the street. Like he now is okay to walk by other dogs.
That's extreme.
Yeah,
That's amazing.
And Pax, he never was actually dog aggressive. He on HRT, he's a little humpy. He in Prague, people are very liberal and dogs are free and they just kind of socialize there in parks and they're off leash and it's a happy place. Like if you have a little dog, you want to fly to dog friendly city, or if you can to get your dog on board or have enough resources to fly them, it's an amazing place. Nobody will ever tell you to put your dog on the leash. Like dogs, kids, they mingle together. And of course, so Pax mingles too. And so when there's a female in heat, he actually somehow thinks that it's the owner that he should be interested in. Because
That's funny.
so it happened one time where this lovely lady, very tolerant, Pax is trying to kind of like make love to a leg, and she starts going like, oh my goodness, hasn't happened to me for a long time. So it was just a little comical situation, but yeah, I think that I think that I would definitely try both. Like here's the thing, that you can try the estrogen and testosterone on its own, because testosterone actually does have antidepressant and kind of like it boosts the mood, right? So you can try estrogen and testosterone together without Suprelorin, see what the results are, and then go from there.
Okay.
Suprelorin is relatively expensive. It may be running somewhere around $300 for application,
Mhm.
depending on the markup and all that. But yeah, in males, I would almost always recommend Suprelorin. In females, you very unlikely will go wrong with giving it. It's more the economy of the whole process. So it'd be an interesting trial because you can always do it afterwards.
Yeah.
And we don't have enough information to tell you for certain. If you don't do Suprelorin, no changes will happen and your dog will be the same. So doing it gradually is not going to harm anyone, right?
Right. Yeah. I'm like Debbie. I want to start tomorrow. So I'll get her in
Keep us
for,
posted, and please
Yeah.
subscribe to there's going to be 5 hours of talking about different things, like learning about the hormone axis and the different implications and what we don't know and what we do know. It's not a course. We called it series because it's more of a conversation. And we had a lot of fun recording it, actually.
That's awesome.
I'll be there. I'm listening.
Yes,
I
I'm signed
know.
up for it too.
It's starting on Wednesday.
Yeah.
So all you have to do is, pardon me?
That's amazing. I can't wait. I'll just click the link into the group and I'll send it out in an email to Dr. Dobias.
Thank
So-
you. Thank you.
Thank you
so
again,
much.
Dr. Dobias. Thank you.
Oh, you're welcome.
And it's also got me thinking about the geldings, the horses, because I do believe geldings get more pathology than mares and stallions. So I'm like, I wonder if we can do this on geldings. So
Yeah, but what about the
obviously-
geldings who were proud cut? Because they still are making some testosterone.
Like the EPM horses, I think it's more, I see way more geldings than mares or stallions.
Okay.
Yeah.
I've been out of equine medicine for a long time and not in Canada really, with the exception of a few horses. What is proud cut?
That's where they leave a little testicle type thing,
Yeah.
and so there's still a little possible sperm
They
production.
produce so they leave part of the testicle.
Yes. My Arabian was proud cut. And so I can't let him out with my minis because he thinks he can still do it.
Well, even geldings can do it. Actually,
Yeah.
it doesn't always have like drive may be still there, but obviously fertility is not. But I do think that I thought of it too because I used to be a horse person. Like I rode for 17 years of my
I
life.
thought you were Dr.
Yeah,
Dobias. I
yeah.
somehow believed that you were also doing equine.
I have to jump in and say, Dr. Dobias, I use your products for our dog and myself, and we need you to get into the horse product world when it comes to detox, please.
Oh
They
my
work so
goodness.
well.
It would have to
17
take me.
years you were in horses, just saying.
Yeah, but well, I didn't work in horses for 17 years. So I tell you what happened. I was 11 and we started, in the Eastern Bloc, we were able to ride horses for like $1 every 6 months, and we would ride horses, but we would also be free labor for the establishment, basically. So we worked really hard. And that's how I got to vet school. I fell in love with the horse that had chronic tendonitis. And
And it was probably a gelding.
no, it was actually female horse, like
Okay.
lovely, lovely mare. And I kind of like as a teenager, I made a wish for her to be sold to private hands as opposed to being owned by the state-owned club. And so it was kind of like I was kind of brokenhearted on some level, but I knew that she had a good life. And that's what was the final kind of impetus for me to go to vet school, were horses. And then I started after I graduated, I worked in with horses for a year. We studied physiology of horses and movement and muscles and heart and ECGs and different things. And then I moved to Canada. So I stopped practicing with horses and I went
Dr.
to.
Dobias, we need a viable omega-3 for horses. That's what we
How
need.
can
We
you do,
need you
how
to
can you
create
do that
some.
though? How can you do that? Like, is there nothing like I think that it's such a, you
So
know,
it's normally like
horse.
flaxseed, chia, Himalaya, and then
Yeah.
some companies are doing fish oil, but that always makes me a tad bit nervous doing fish
That's
oil with.
strange. How horses, horses may have different ability to convert the omega, the alpha linoleic acid into DHA and EPA. So I think that they probably do,
Yeah.
but I I don't
They're-
know.
I think the length of their intestines allows better conversion
Yeah,
because
I
it
I
stays in the
would
body.
not be surprised. I would not be surprised.
I think we need more options in heavy metal detox for horses. And you
Well,
have that specialty with dogs.
Spirulina would be really
Yeah.
interesting.
Yeah.
Alga carcaria would be really interesting for mineral supplementation as well. I have even no clue, like, milk thistle, is it even safe for horses?
Yeah, it's good. I use it all the time.
Oh,
I
is it?
use it quarterly with dandelion leaf to do detoxes.
So, looking at, what I would do if I like, obviously I won't be formulating equine products. I would, I don't want to be a schmuck. I'm a perfectionist, but I would probably look into the herbs that we have in the liver tune formula,
Mm-hmm.
which ones are safe for horses.
Mm-hmm.
And yeah, definitely if milk thistle is safe, it's obviously one of the primary
Yeah.
ones.
And
I
Obviously,
was
I've
just
never,
looking at that last night. So now I have to figure out the quantities for the horse.
What about zeolites for horses? Could they
yes,
tolerate zeolites?
yes, they do well with
see,
zeolite
it's
And
Poppy's arena.
and bentonite.
and bent.
I'm
So
yeah.
on bentonite, you just have to watch, and you probably do on the dogs too, is you if you're doing hormone replacement injections, your bentonite might flush that.
I'm talking about horses though.
Yeah, so definitely the bentonite.
I
And
don't know
your
if
bentonite,
if you give an injection, I doubt it. I
Yeah.
doubt it. But again,
Yeah,
like,
I would be interested in the dog part because, I've been giving Taya and Betty bentonite. for, you know, whatever they were going through. So
Mhm, mhm.
Go
You
off
would-
before your injection, please,
There was a
because
vet,
I've seen that.
there's a vet up in Washington State, and she had a really good detox. I don't know why she's not selling it now. She had been part of one of the can't think of multi-level marketing families, but it had zeolite, bentonite, and the herbs in it too. But she's not doing it anymore. And I used to give it to my horses at least yearly, and it made a big difference. And I just wanted to input something while we're on this. I went into Helios in the UK. They do have homeopathic remedies for testosterone and estrogen.
Right.
So at all the different levels.
Yeah, but you know, it would, I just don't really,
Yeah, I wouldn't know how to use it.
I wouldn't know how to use it either,
well,
but
it's
they
not about
got
how to use it, but the logic of, you know, vibration, one wave neutralizing another, right? So that's the principle of homeopathy. But if there is no testosterone, giving the testosterone homeopathic remedy, like how would it logically work from the principle of
Yeah, unless it was a
literally
low
giving,
potency, unless it was like a 3C.
they've
and
got
even though
6C.
it's oral again, and so if it's energetic, like or did you say that I probably wouldn't go that route? I think the LH homeopathic remedy makes sense. If someone proves me wrong, I'll pour ashes in my head, but it doesn't make sense.
Don't do that.
And there's a lot of space to pour ashes on.
Yeah. Carol, did you want to jump in there really quick and ask, or did he answer your question? And then we'll let you go, Dr. Dobias. You've been more
Oh,
than generous with your time.
I'm happy to answer questions. I'm happy to be here. Thank
Okay.
you for having me.
Yeah, no, my question was about EPI.
Uh-huh.
And it kind of goes back to the control factor with, you know, just providing a replacement enzymes. How do
Yeah.
we get past that and start? I mean, I come at everything from an engineering background. So I'm always doing a 5Y, you know, I love pretending I'm 2 years old and just keep asking why to the point people want to throw me out a window. But it gets to a lot closer anyway to what the true root cause is.
So
And so
pancreatic insufficiency, um,
Which is
oh my,
metabolic,
yes, well,
or
yeah,
is it?
maybe.
I think that it's obviously genetics play a role, but I think that it's autoimmune. So I think that it actually does start with inflammatory changes in the pancreas. We know that there are increased demands on pancreas with, let's say, processed food or, you know, excessive immune system stimulation like vaccination. I would dare to say that it's very likely that LH and spaying and neutering is very possible part of the problem. And when you lose the enzyme producing cells, um, based on what I know from practice, it's very rarely that you can actually restore them unless you catch it in the early stage. And when it's gone, when there is the insufficiency, then supplementing the enzymes is actually not a bad way to go. I'd be very surprised, but you know, again, like you can try in this situation in a spayed and neutered dog, definitely HRT, definitely good diet, definitely good supplementation, also enzymes, just to make sure that you don't compromise digestion and so on, and
Glandular,
see what happens.
pancreatic, and
Absolutely,
yeah,
absolutely as well. I love glandulars,
I do too.
and I think glandulars not only supplement the building blocks for the organ that is affected, but also maybe deters. It acts like a deterrent for the antibodies that are created against that organ, right? So if you take pancreas and you have pancreatic inflammation, by giving the pancreas the antibodies against the pancreas that the immune system creates can get neutralized and prevent the damage. That's how I understand it.
Carol, did that help?
Did it help? Maybe not.
Only in part.
So tell me
Because
more. Tell me more. I'd like to make
yeah,
sure.
sure. She is intact.
So that's good. Then you have that one
Yes,
out of the. What kind of diet have you been feeding and what breed is she? How old is she?
she is 4 now. This started when she was about 4 months old. She has been on the enzymes since about 6 months old.
How many vaccines did she get when she was young?
She had the puppy set.
Which is extreme. At least it is in
I dare
California.
to say that if I have such close correlation with, 3 sets of antigens, vaccines, 20 different diseases in 1 to 2 months, I would not be surprised if the immune system just freaked out and destroyed what it shouldn't have destroyed. Homeopathically, I would probably start with just simple old Thuya, 200C. I would give 2 doses, 12 hours apart or similar, and then see if there's any improvement. But, it's very likely that this is set. She's 4 now, and I don't really know whether she's got any function or partial function or not, but you will not go wrong by supplementing the enzymes in this case. And you will not go wrong with giving homeopathic remedy. She's intact. That's great. So this is not, I'm not necessarily saying that everything regards hormones, but if she was spayed, I would do exactly the same thing plus hormone replacement therapy. It's almost like it's relatively simple in treating almost any disease. What do? You kind of assess the patient, you see what is wrong, what the symptoms are. You try not to suppress them, but work with them. You provide the right nourishment. You detox, you provide the right minerals and omegas and probiotics, see what is left, and then you align the spine. You do some, whether it's acupuncture, herbs, or energy healing, or anything that you guys also do, and then see what is left again, right? But in the process, if I have a neutered or spayed dog, I have to assume that there's a possibility that there is a problem caused by that, at least partially. And if it's not related directly, I still will not harm the dog that has insufficiency of hormones. It's very likely that I'm going to cause problems. Does it make sense now?
Well, that certainly does. I just know that doing some research like recently on this, that there also seems to be a key in with the vagus nerve and stress response. And so I was wondering how cortisol, adrenaline, adrenals
I am not aware
might
of the
play into
connection.
that.
I'm not aware of the direct connection between pancreatic insufficiency and stress, but at the same time, as I'm saying that, I'm saying, chronic disease can be caused by stress, and the stress can come in a form of sudden shock or shocking the immune system with vaccines, or doing other, like it's hard to know. Like this is like a 1,000-piece puzzle, I think, and you may not be able to find out why. And in that case, you just need to try to fix what you see, repair what you see,
Sure.
and see what is left, right? And if you're lucky, you'll be able to solve it. And in some situations, and it's humbling, but sometimes we may not be able to solve it. But supplementing the enzymes in pancreatic insufficiency is actually, that's what I would do for sure. And I would try to restore the pancreas function, especially if it's partially functional, by using Thuya and making sure that the immune system is in top-notch shape, and that nutrients are right. There's actually one more thing. Pancreas and stomach actually energetically relates to the thoracic lumbar junction just past the last rib. So if your dog has sensitivity or injury in that area, that needs to be addressed by acupuncture, needle therapy, laser, other methods. Vagal nerve, I always say that that no dog should be on a collar and a leash and a retractable leash, mainly because the vagal nerve actually originates in the neck, can get injured, affects the lungs, the heart, the digestive tract, the internal organs. Absolutely right. But I can't really tell you for sure that that's related. But I would.
It's an interesting thought. And I read your article on the collar, and I read your article on pancreas and bone alignment too, Dr. Dobias. So you have all this content out on the internet that people can read about too. So on the adjustment, he cites that whenever dogs are having pancreatitis, there's a vertebrae that cohabitates with that, and it seems to be
relates it's an energy line. Dogs that have a propensity to get bloated, they usually have spondylosis or arthritic changes in that area. Actually, often. I
wow.
used to see that. That means long-term inflammation before the bloat happens.
That I had a little English bulldog, and he had arthritis in the back and the hips, and he bloated earlier this year, and we had x-rayed him and saw that the arthritis had progressed.
Very common, very common.
Interesting.
Yeah.
Huh. I didn't know that. Thank you for sharing that. Charlene, hop in there.
Hi, Dr. Peter.
Hello, Charlene. Hi.
So if testing for LH is not available here in the US, what measures can we take to evaluate whether or not HRT is needed for our dog?
Do you have a male dog or female dog?
A female.
And she's spayed, right?
Yes.
And she has had an autoimmune disorder, doctor.
In that case, I would not even bother, to
Yeah.
be honest. Like you can measure estrogen, but we don't really know. We know that luteinizing hormone is going to be elevated. We know that estrogen is not going to be high because the adrenal glands are not producing sufficient amounts. That's a prime example where I would just not wait a minute, actually.
Okay. So, but can you also answer that question more generally, not specifically for my dog, just because other people out there that are listening, or if I get a different dog, how would I evaluate that?
If my dog is happy, ages normally, doesn't have any mobility or behavioral or organ disease or anything, allergies, autoimmune disease, like any chronic problems, then I probably would not be doing HRT.
Okay. And is HRT, is it once you start it, then you do it for their life, or?
That's how I understand it.
Okay.
But mainly because obviously they don't produce Pax's bark, Paxi,
Pax, come on. We want to see you.
He's on the bed. Oh my goodness. Anyway, I'll answer the question. I may bring him to say hi after that. So yes, it's for lifetime based on how I understand it. I have a friend who was told by a doctor that they will do HRT for her, human female. And then, when she'll get older, maybe they'll just kind of wean the hormones off. And I was thinking, like, how does that make sense, actually? Well, it can be too much. I go, really? Like, I don't really believe that because it just doesn't make logical sense. But again, there's still a lot to learn, and that's why we've established this Hormone Health for Dog website, and will be kind of hopefully bringing more and more information. This is like a lifetime project, I have a feeling.
Oh my goodness, I agree. Kathleen, I know you wanted to ask about a cat, can you do the
Ellen, thank you,
same?
by the way.
Can you do the same thing with cats?
Um, it would be a question for Dr. Becker more than me. I haven't worked with cats for a long time. And the main reason is that I think feline medicine is so different. And I just felt I can't really be good at both. But I do know that cats are, I don't know whether it's called that way, but their ovulation is provoked by the presence of a male.
Right.
So that is quite different. Um, the general opinion is that cats are not as sensitive to hormone absence as dogs. If you really honestly ask me whether I believe it, I'd say that we are just not looking enough because cats have chronic disease and they
Yeah.
have allergies and they have all these different issues. And I think that it needs to be explored a little more. But if you have a male cat that is neutered and you put them on HRT, it's gonna be the scrapping, it's gonna be the peeing, it's gonna be all that.
Yeah.
I think that many people are saying that cats don't get affected because they don't want to even think of
Deal
how
with.
complicated. They don't want to deal with it.
I think I read when I was researching about dogs that some veterinarians, that was the theory that cats aren't affected like felines aren't affected like canines are. So, but probably there's not the same research.
Yeah, and people don't want hormonally
Yeah, I
excited
wouldn't want a
cats.
hormonal cat. No.
Well,
It's like
and we've so
cats
much
are like
of the
it's
canine
like
research was like we've just attached that to cats, and cats are so brilliant at hiding, even more so than our
and
dogs.
they're
I
so
was just going to say
different.
cats just aren't cooperative, so it's going to be more difficult to do to do the studies on them, and you have to be a little bit more. I mean, you really have to get to know cats in order to intuit the information that they're giving you symptomatically, I think.
And imagine having a cat in heat, like on estrogens at
Oh
home.
God.
Oh my
Yeah.
goodness. Like
Yeah.
you're gonna lose your sleep for sure.
Oh, hell no. Yeah, no.
So I don't really see. This is actually the limitations of these are the limitations of our life and existence. Like we just can't solve it all. And maybe down the road we'll be able to solve it, but right now we can't. So
Well, we're at the tip of
it's
the
humbling.
iceberg, I think. I definitely feel like herbs, like, wild yam and red raspberry and black cohosh and blue cohosh and all of those herbs could also be productive, but nobody talks about it. In horses, we do a lot of hormone herbs in the mares, but we don't do hormone herbs in dogs and cats.
Yeah, I think that Rita actually speaks on that a lot, and Rita Hogan. I just came back from Mallorca. There was a conference organized by the British Raw Feeding Society, and Rita was there, and I was there, and we were in a podcast. If you know the podcast, I think it's
Raw pet medics.
Vet Pet Medics, no? Or Raw
Yeah,
Pet
raw pet medics. Yeah.
Yeah, so the podcast is about maybe 2 weeks old. And so we were just kind of comparing notes, and I think herbs can be supportive. They will unlikely replace the hormones in it, obviously in the original form, but it can. I'm quite certain that herbs have a huge place in medicine. My grandfather was a herbalist. I used to pick herbs with him as a kid, and I remember that in the old days in the Eastern Bloc, actually, he would be, showing me book and the herbs, and it says, and this is in this drug, like it would be pharmaceutical drug, but it would be made of herbs because the drug companies did not have the tentacles in those areas of the world, and so yeah, they were made of natural herbs.
Yeah. They can't they can't profit off that. So they have to make isolates.
There is an amazing podcast, you guys, if you wanted to, and I can look up the name. uh, by a doctor who's been kind of repurposing drugs that exist because he says drugs are used for like one or two metabolic pathways, but they may affect 20. And so, he was giving examples of people being cured from terminal diseases and surviving way, way beyond, because some of these drugs are not researched in that area, and they're taking all these drugs and actually looking at the pathways and seeing if there's another use, right? So aspirin in heart attack prevention, or there's obviously some other drugs that are being looked at, and it's interesting.
Saffron and antidepressants.
Exactly, and it's calming as well, right? Like I've heard
Yeah.
about it yesterday. It's so interesting. I just listened to a podcast on that.
I
But
love saffron.
yeah, and so I'm not a heavy, like I have not been on any medication for a long, long time, like any antibiotics or any anti-inflammatories or anything like that. But hormones are in a different category. I think they really are. And even Karen, when we had that discussion in the series, we kind of agree that they're just a different group, with the exception of prednisone and all that, because it's just those are drugs that I don't like at all, because they're used in excessive amount and doses. So
That makes sense. Charlene, one last question.
Yeah.
And then we'll
So
let
I
him
wondered-
go.
I had some follow-up discussion when you were talking about my questions earlier. On your website, I'm just a little confused, because it sounds like you were saying to look at the symptoms to determine whether or not HRT would be good, but on your website it says that it's according to the blood levels and that it needs to be monitored. So if we're not testing and we're not monitoring by blood and just doing by symptoms, how do we know how much to give?
yeah, so I so appreciate you saying this, because this is what happens when you get busy and when you don't have time to actually adjust, because we've been actually looking at this, and as we progress through the recommendation, we basically have stripped it down to what we think is actually doable. So this is on the website, on hormonehealthfordogs.com. It's old information at times when we thought that we could be measuring on a regular basis.
Okay.
And we discovered that we can't. There's one lab in Europe somewhere, and I can't remember exactly where they do it, but Pax keeps barking for some reason. There's someone outside. So I promise I will fix it, and I will adjust the blog.
Okay.
I didn't notice that it was there. We've been focusing on the other website, and this website has been there for years. So
Okay, thank you.
Char-
My
Charlene
last
calls me
question
out.
is
Charlene calls me out on my stuff all the time. Yeah.
yeah,
it's
oh
my
my
spiritual
goodness.
gift. My
No,
last
it's good.
question
It's good.
is
I like it. Thank you.
my last question is there any contraindication between use of prednisone and HRT if a dog has been on prednisone in the past, like high doses of it?
Oh
But
my
not
goodness.
right now, correct?
Not
Oh.
currently, but
No,
I do want to know, is it something to be worried about if they are on it, at the same time?
there's a
Can they do it
uh,
concurrently?
to be honest, I don't really know.
Okay.
I only know that prednisone is a medication that I almost never needed to use in practice. Even with the absence of some of the knowledge that I have now, I've been always able to somehow manage without prednisone.
Mm-hmm.
And shall I be honest?
Yeah.
I freaking hate that drug.
Yeah, I do too. Do you have any experience with masticatory muscle myositis?
Yeah, of course.
Really? And you
I
did
think
not do
I think that
prednisone for that?
no, not for any of these autoimmune conditions, or absolutely not. I used
Huh.
homeopathy for that. I used heavy doses of omega oils. I would use IMS. I would also focus on neck and neck alignment.
Wait, what's IMS?
Intramuscular needle stimulation, similar
Okay.
to acupuncture.
Okay.
I basically just do the same thing that I would normally do, applying the healing cycle and detox nutrition supplements. Maybe I would do hair testing for checking on not only toxins but also minerals. I would do liver cleanse. I would do IMS, spinal alignment. I would do laser. oh my goodness, I would do laser. Um,
Laser like on the jaw muscles?
uh-huh. I would do the neck. I would, you know, the funny thing is that with laser, you laser iliac crest, which is by the hips. And there was a research study where they induced, unfortunately, induced heart attacks in pigs and lasered the iliac crest. And the pigs recovered 40 times, 40% faster. And it's due to the stem cells actually being generated in the around that area of iliac crest and traveling into the heart and healing the heart faster. So you can actually do local treatments, but also regional in the areas where the stem cells are produced. I swear
Amazing.
by laser. Dr. Laurie McCauley has actually course on laser use. You may have known her, and yeah, she's great.
Yeah, I haven't taken her tuning fork class, but I really wanted to, but I didn't know she had a laser class also.
He has a
So
laser class, and many of our clients actually have home laser. I have a home laser here. I carry it everywhere we go.
that's cool.
Do you
And
ever come to the States?
I do. I've got license there. I was in Florida, obviously, where I met Poppy and Janice as well, right?
If we
And
sign
Julie,
waivers,
Jen.
could
Debbie
you
as well.
treat?
I'm sorry?
Are you allowed to treat if we sign waivers?
No, I can't.
Okay.
They would kick me out. I would not be able to come back.
Do you do Zoom calls, like remote?
At this point, you have no idea about my life.
You're so busy. I bet you wouldn't want to.
So here's the thing. This is an honest couple of hours. So I really miss practice, and I would just love to sit down with patients and kind of start applying what I've learned even in the last few years. And at the same time, I know that if I start practicing, that my clients deserve full attention. Meaning, if there's an emergency, something is happening, I just need to be there. And there's just too much happening. Like with my formulas, with running basically the circus, having team that I want to look after, want to write. I'm in the process of writing a book as well, which I haven't told too many people. And so I just can't. And I'm also 61, so
You've advanced to a different level of usefulness. Now you need to be, now you need to be the guide rather than, because in practice you're not as much of a guide for the whole
community. That is true too.
profession.
Yeah, thank you.
And now you
Thank
really
you for
need to
saying
be,
that.
now you need to be, because of your knowledge, you need to be more of a guide for the profession.
Thank you. Well, I've been kind of timid when it comes to teaching other veterinarians, mainly because, but I'm actually getting to a point where I know that there are many open-minded colleagues, and I see that conferences. But you're right. Like you can't really you have greater reach, and my real joy is to empower you and empower people who are open-minded, and then seeing how you apply it. And that's like amazing.
It's so valuable. It's so valuable.
I hope so.
Yes.
I hope so.
And we would have never known you're 61.
There's much more coming. Yeah, immature. Like I'm never growing up, but
Poppy, the
Yeah.
tuning for I fell yesterday. I tripped in this house I'm staying in. It's got a crazy ass bathroom, and I tripped going into it, and I hurt my leg, and I really jolted my shoulders. I did the tuning fork along my shoulders all night. It loosened the whole thing right up. It was amazing.
That's so fun.
So, and I've been doing it a little bit on the. I've been doing more red light on my
It's
ankle.
just so much to learn these days, and it's so fun. But it's like that time.
I mean, and I didn't, I took the
balance.
course, but I just did it. I mean,
That's so cool.
remember to only keep some channels open, because I've seen many people trying to do too much, and I think it's overwhelming.
It does.
And,
It absolutely does. Yeah,
let me
I
just
want to
see
try
you
if
need
it.
to start
Pax wants to
carrying
say-
a red light in your pocket too,
Let me just
because
see if Pax wants to say hi. And I've been sitting in my lotus position, so I will probably, I'm all stiff now. Oh my goodness. Ah.
That's how we know you're
When
61.
when he sit no well when he sit on a pillow for
I'm younger than 61. That would make me stiff.
I know
Yeah.
the lotus position. I can't even imagine that for 2 hours.
It's the second hour because I've been editing a video before with my friends, with my teammates. Maxi.
Poppy, this has been great. Thank you so much for having
It's been
him.
amazing. Yeah, I really love him.
I'm so glad that he said yes. I've been so intimidated to even
To fear, and evil's running rampant like a plague through
This
this
Mary.
applies all to me
Hell.
as well. I'm on hormone replacement therapy and I'm a mess and I have autoimmune and thyroid and I mean all this knowledge, information.
Oh my goodness.
Oh my gosh.
Oh,
I'm gonna
Yeah,
make you
Hi, Paxi.
he's not sure. Oh my goodness, what's
Pax.
happening here?
Thank
You
you
got
for all your
notes?
help, Pax. We salute you. Thank you, Pax. Look how bright he is.
Yeah, well, he's very jet lagged right now, but
But his
so he's
eyes are
not,
really bright.
but
Dr.
he's
Dobias.
not impressed with me.
He's yawning.
Goodness.
Well, thank you for your time. This has
Oh,
been
thank
so
you.
valuable for all of us.
Thank you,
And I
Dr.
definitely
Tobias.
want to start this also on my foster dog because
Keep us posted, and we'll do our best to provide as much support as we can. If there are any people who would like to help eventually volunteering, just let us know. We'll be actually setting up, over the next few months, just kind of see how we can get this going a little more.
yeah, we could probably
uh,
host a online event for you guys with a large platform or something to get the word out.
Yeah, what we need to do, we need to decide what we want to do exactly so we can present it. The Parsemus Foundation has a research team, and we would like to connect with other researchers. Obviously, we don't really know how well it's going to go, but I think that it's going to be really meaningful to get more studies. So the
I live 45 minutes from UC Davis.
Oh wow! Yeah,
So I could talk to them about it. I'm friends with an instructor there.
that sounds amazing. That sounds amazing.
This may or may not be a thing. I mean, I'm not far from University of Florida, but I'm right around the corner, about an hour and a half from Dr. Shea at the Chi Institute. I don't know if he'd get involved with something like this. And he used to be my vet, so I have a really good
It'll
relationship.
be, I think that the more the merrier, right? In this case, definitely.
Okay.
And ultimately, you know how it is. Like first they laugh at you, right? Then they, whatever. Like there's a saying. First they laugh at you, then they something, and they want to be you. So, so it's just a matter of deciding what studies we need to do, and yeah,
Well, we can unite the allopathic and the holistic. Like I feel like if we
I'd be a
all
little
have a
careful doing
common,
that.
I think if we all had a common passion and there's true science behind it, it would unite us.
Yeah, absolutely. And you know how it is. Like people often say, well, less so now, but still, I think that research in science is still taken as the standard, right? And I think that it has to be both combination of experience and even intuition and science. And
Right.
the best doctors, the best practitioners, the best experts actually know and understand it. So
Yeah.
thank you so much, Poppy, for organizing this. And thank you everyone for being here and being interested in this topic, and give your animal friends a hug for me, and we'll be in touch. Okay.
Thank you for being
you,
here with
Thank you.
us.
Yeah.
Thank you.
you.
You're
Thank you.
such a
Thank you.
gift to all of us. Thank
Oh,
you.
come on, stop it.
Oh, yeah, we want you to get a big head for sure.
Well,
Now you're going to be
that's
too
it.
good for us. Now you'll be like,
I think that I've managed to have my ego in check, but you never know. You have to let me know if it starts acting up. Okay.
Charlene's the one to keep you in check.
Okay.
So
She-
I say my professional opinion is you deserve all of that ego.
yeah, I
No,
agree.
no. I actually don't. You don't say that, because I think that it really can be
Auntie, what are you doing?
detrimental. It can be detrimental. I actually every morning I just kind of throw it in the corner and stamp on it.
The best practitioners I've known over the years are the ones who who study humility.
Study humility. I think that life kind of humbles you, right? Like
Yes.
if you're, life
Yeah,
humbles us.
absolutely.
Yeah.
Yeah. All right. Have a great week. You guys,
Thank you.
next week's Chelsea Kent. So hop back on and we'll see you next Monday. Thank you.
Take
And I'll
care.
give you a
Bye.
copy of this.
Oh, thank you. That's really lovely. Thank you. Take care.
It's-
I'll keep you posted on Candy,
Keep
what
in
I end
touch,
up
Poppy,
doing.
and everyone. Okay. Bye bye.
Okay, bye.
Bye.